I want to take a step back and ask you to reflect with me a little bit on what it is that we learned from this little case of Devi Shetty and his band of merry men. They're mostly men, a few women, who've come together to create this wonderful focus factory type of health city, with each piece providing cutting-edge, state-of-the-art tertiary care, but at affordable prices to the indigent of the world. What did we learn from it? I'd like you to take a look at this picture. At the center of the picture is the centerpiece of the original part of the experiment, scalable heart surgery. I'm talking here about the heart surgery piece of this. Now, scale is not automatic. Even though you are in a sea of cardiac distress, it's not automatic that patients will come to your door. So the scale itself has to be provided. And a non-trivial part of the entrepreneurship that Devi Shetty and his team showed, particularly in the early years, was to think about how do you go from a situation where people are dying because they don't receive cardiac care to one where people realize that there is a place where they can go to get cardiac care, regardless of constraints, and have a reasonable shot at becoming more healthy. It turns out that Devi Shetty, the cardiac surgeon, humanist, philanthropist, entrepreneur, whatever label you wish to assign to him, while primarily being a doctor, a healer, a heart surgeon, has also had to be an entrepreneur in a bunch of unlikely areas. The simplest of these is the medical bus. You can see a picture of it surrounding the central idea on this graphic. The medical bus is important. It's simply exactly what it says. It's a bus that every so often goes to remote villages near Bangalore, sometimes some distance away from Bangalore, and rounds up patients. It's just simple medical outreach. Now, that's supplemented by all sorts of other forms of communication, some very low-tech print media types of things in local vernacular languages, some high-tech, some social media, this, that, and the other. But really, it's about medical outreach. And an extensive amount of medical outreach had to be done to educate people about what was going on in the hospital. That's part of the entrepreneurship. Moving up from there, we talked about telemedicine earlier in the context of expanding to Africa. But telemedicine, of course, started in a much more local setting. The telemedicine here represents entrepreneurship in a bunch of different ways. Shetty had to find a way to create the protocols through which less trained physicians and healthcare providers, general physicians, even nurses, people who had been trained for a couple of years in different village settings, could at least know what questions they should ask to the surgeon to begin to understand whether the patient who was in their care needed more cardiac care or not. And that required a lot of experimentation. That required a lot of protocols we put in place so that surgeons understood how to interpret the questions that were being posed to them, surgeons understood how to answer the questions, surgeons understood the behavioral nuances of responding to a query that came to them from a poor, uneducated person sitting hundreds of miles away. I always remember one time that baby leaned over to me and said, "Do you know why I'm only talking to the woman, even though the patient is the man?" So there was a elderly gentleman who was in obvious visible distress, and there was a lady next to him, I presume, who was his wife. And Devi kept addressing himself to the woman. And Devi then explained to me offline, I have learned over time that for whatever reason, and we can have a value judgment on this if we wish, but this is an empirical statement, that it is far more constructive and productive to explain the treatment that's needed to the woman. She turns out to be much more in control of the household setting. She turns out to be much more in control of ensuring that the man engages in the behavior to be compliant with this. And that's just something I've learned through practice. That's an example of experimenting and iterating to get the communication right. And they've had to do this in spades. So he's had to be an entrepreneur in getting outreach done effectively, as well as communications to patients who are not used to soliciting cutting-edge care. Another way in which telemedicine represents entrepreneurship is dealing with the state. Devi has had to work with a state that generally is not very well functioning. Witness the complete absence of the ultimate public good that we're talking about here, health, which the state does not provide and is in no position to do for the foreseeable future. But he's been able to go to the state and say, Mr. Government, you do have assets that are useful in the delivery of care. You probably don't realize it. And it turns out that they're underutilized. So may we please use it for this productive purpose? And the asset in question that I'm thinking about here is spare satellite capacity.